So, you know, do get your tickets because they are going fast, and it really is difficult when you get up into 550 plus to serve everybody, but the staff has it down pretty good.
Yeah, well, we counterfeit the tickets, you know. So
oh, yeah.
everybody gets one.
Don't tell Becky that.
You'll find there's several thousand tickets when you count them up later.
You're crashing the party, huh? Well, it should be a good time, and we hope you all join us. I do, you know, nutrition is kind of the core of what we do. You know, that's how Office for the Aging started with the Older Americans Act, and ensuring that seniors are getting good nutrition, because that's the core of good health. And one thing that's going on right now that we're not seeing as much participation in is our farmers market coupons. So we really, if you are a lower income senior and you could be eligible for farmer market coupons. It's a $20 I guess gift certificate, you would say, that will help you, that you can spend at any of the farmers markets around the county that are participating. There's one in Westfield, Fredonia, Dunkirk, Jamestown. So as you get those tickets from our office, we will give you a list of the participating farmers markets, so you can go pick up fresh fruits and vegetables now that they're in season and local. So please take advantage of that. Most people who are in HUD housing should be eligible for that.
Actually, your eligibility, I noticed, was pretty generous.
It is, and I don't remember the specific number.
I think you could be making, as a couple, probably pretty close to $25,000 a year or something.
Well, as I said, I don't remember, but if please call our office. We'll tell you what the what the income guidelines are, and you can stop into the office, or we may have a few more distributions coming up. We did have one already in Dunkirk and Jamestown, so call our office, and we're happy to connect you if you're eligible. But don't pass that up. It's a great way to support our local farmers, as well as making sure that you're getting enough, fruits and vegetables in your diet.
You're limited to 20. That's every month or every year?
No, unfortunately, that's just a one-time, once a year.
Once a year.
Once a year. They send us about 800 coupons, though, so we can serve about 800 people under that program, and so please take advantage of it.
Get on the horse and ride on in. Yeah, $20 a pop. Just for applying, unless you're rich, and both seniors that are rich in this county, they don't care. Maryannspanos, Director of the Office for Aging, and she's telling us how it is over there. Now, Maryann, as you mentioned the coupons for the farmers market, you also have a restaurant coupon, don't you?
Yes.
People should be aware of these
That's
things.
an ongoing program, and we just started a new restaurant. And I'm going to try to figure out, I think it's called the Rainbow.
While you're raking it in, I got a call here.
Okay, good. Let's take the call.
Good morning, caller. We'll be right back on the restaurants. Here we go. Hello.
Good morning.
Good morning. What's up?
Okay. I keep hearing from a lot of seniors that doctors are no longer taking Medicaid patients and so forth. Could your guest comment on this?
Certainly. I assume there are always doctors who don't have to take certain insurances. I'm not sure which doctors don't take Medicaid. The one wonderful thing I can tell you about, though, is we were just, the county was just awarded a federally qualified health center. And it's going to be located at the county buildings in Dunkirk and should be up and running within a couple months. This is very exciting news, because in that clinic, it doesn't matter if you have no insurance, they have to see you. And so this is really a wonderful thing for our community. The problem, I think, is that we are an underserved area. Doctors' offices are full and turning away patients. I don't know that they can legally turn away Medicaid clients. I'm unsure of that. That would be a question for the Department of Health. You can call the county offices and ask for the Department of Health or the Medicaid director, and she would be able to enlighten you on that. But I know that some doctors' practices are closed. they are absolutely full, and because we are underserved. So, but there are certain practices that do cater to Medicaid clients. I know Dr. Burke's practice here in Mayville is very open to those clients, and he helps with a bunch of clinics, little clinics that are in some of the townships all over the county. But I think it is terrific news that we will have this federally qualified health center, and it was the Chautauqua County Health Network and Abdella and her team, Mike Pease and others, who helped to bring that to our area. It's been 5 or more years in the making, so it's really exciting news because there are so many people, whether they're Medicaid or non-insured, that can't get regular health care. And you know, if you don't get regular health care, that's part of the problem with driving the cost, because then people are using the emergency room inappropriately at a very high cost, and if they don't have insurance, it all comes to all of us. That's why our insurance is going up, because we have to be able to give enough to cover all those people who are uninsured.
A lot of people don't realize part of the charge of your insurance does cover uninsured people. Now, that's one of the reasons you said Medicaid, unfortunately, Medicaid is detached from the market, unfortunately. It's separated from the market. Mm-hmm. The amount of money Medicaid pays is so far below what a doctor normally gets. That's why they won't take Medicaid. When they're packed, they say, well, I don't want anybody who's going to pay me $5 for a filling when I'm getting 50. That's the way it works.
Now, and this is...
Well, I'm not defending them.
Okay.
I'm not finished, though. That's why you have the emergency room cramming you mentioned.
Right.
If you can't get service immediately, it gets worse. And then you wind up in an ambulance going to the hospital, and there you're going to pay through the nose. It's going to be a $2,000, $3,000 charge for that patient that could have been bandaged up for 50 cents, you know. So you're quite right about that. That is why, incidentally, a lot of hospitals are going bankrupt. One of the major reasons. They have to pay for this, and they don't get enough money out of it. You're on. Go ahead. You're gasping. You want to say something? You still want to talk about the restaurants?
Oh no, you know, that's been, you know, we have a problem with the health care, and that's why I say that no matter if you agree or disagree with what the federal government came up with in the Affordable Care Act, we did need to change our health care system, because it is about emergency care right now instead of getting everybody into regular health care to keep them well and prevent these higher costs.
Sure.
So.
I will say the higher costs can be controlled in certain ways. I think one of the higher costs that can be controlled is the county home, incidentally, but that's beyond my purview. I'm not a legislator. Lori Cornell is, and she's hot on the subject. I got to have her come in here and tell us why they're. Can I use screwing the seniors, the indigent seniors? But at any rate, that's what's going on. Health care for seniors is in many cases being cut by the Fed, by the state, and by the local. And we've got to stop that, and that's what you're there for, to help out, to make sure that, as you say, there is affordable services for senior citizens. And
I think, you know, one of the wonderful things that came out of the Affordable Care Act is now there is no longer a copay for seniors for their annual health checkup. There's no longer, you know, they're trying to eliminate the donut hole on medicines. That's a really plus for seniors. And if you go for your mammogram, colonoscopy, prostate check, all of those now are free. And that's really an important change. I also want to tell people about a new program. One of the biggest costs to Medicare is these constant rehospitalizations. People go into the hospital for a particular problem and they get discharged, and maybe they don't understand maybe it just happens so fast that they really don't understand what they're supposed to be doing. They don't follow up with their doctor, and they're getting readmitted. Every readmission in this country costs a minimum of $10,000. Yeah, a minimum. So there's a new program that we are entering into at the Office for the Aging with all of our local hospitals, WCA, Brooks. Westfield and Lakeshore are involved in what we call the Care Transitions Project. And the Office for the Aging has coaches that are meeting up with people who have certain diagnoses in the hospital, and then they're following them to home and making sure that they have everything that they need to be successful, that they understand what needs to happen after they go home. And the other plus is that we can link them to a lot of services. It's really important that you follow up with your doctor after a hospital admission. And now a lot of the hospitals have what they call hospitalists. It's a doctor that only follows you in the hospital, and it's not necessarily your regular doctor. So it's really important that you meet up with your regular doctor after you've been in the hospital to go over things and make sure that you're all on the same page as far as your care. So we are going to be visiting people, and it's already started at WCA. We're meeting with people who have congestive heart failure, pneumonia, or COPD, chronic obstructive pulmonary disease, or anybody that's been readmitted within a 30-day period. We're going and meeting up with them at the hospital and telling them a little bit about the program, and then we're following them home. And
that's what I want to ask. What do you do at home for them?
Well, we do a couple things. It's really, we're trying to be a coach for the client. We don't want to do things for you, but we want to make you feel comfortable doing everything that you need to do. So we go over your medications with you and help you brainstorm if you've not taking them, or if you've got conflicting instructions about how to take them. We coach you about who to follow up with on that.
Do you call them or do you just visit them?
No, we visit them in their home, and it's quite a lengthy visit. It can be up to an hour and a half, 2 hours in their home.
Nag them about their medications. Make sure they take them.
No, that's just a piece of it. We also try to produce for them we want to know what their goals are to getting better.
Live longer.
Right, and a lot of people have some events coming up. I want to get to the grandchild's wedding or whatever it may be, staying in your home as long as possible. And we hear that a lot. We don't want to go to the nursing home. Okay, so what can we do together to make sure that happens, that you stay in the home? We make sure they have their follow-up appointment with their doctor, and if they don't have a ride there, we might link them with transportation services. You know that the Office for the Aging works with carts, and we help to provide those rides to your medical appointment. We also have a volunteer medical transportation program that helps take people out of county who can't drive themselves.
How does that work, the volunteers? How many do you have? Does it, it sounds like it'd be a pretty tough program.
It is. We need more volunteers. So we do pay the volunteers their mileage, but we have probably several dozen volunteers who take them to their medical appointments in Erie and Buffalo. We have to be very judicious about it because we do have limited funds for that, but many of the people who are being taken there help to pay for the ride.
You do get rides. We got a call. You want to take
Sure. Let's take
Good morning, caller.
Well, good morning. This is Linda Spalding. Good morning, Mary Ann.
Hello, Linda.
Good morning, Linda. How are you? How's Doug?
He's hanging in there like we all are.
Great.
It's great that you're on the show.
Thank you.
Well, she comes on every couple of months. She gives up a lot of her time to come on this show, especially her Saturday mornings when you should be cooking the Slovakia or something important,
Sleeping in.
So I just wanted to call in and say that it's great that you're on the show, and that, as usual, I mentioned the Senior Employment Program. And
how's that going? Do they have any jobs open now?
Well, right now there's been kind of like funding cutbacks.
Oh, who cut your back? The Fed?
Somebody. It's the federal funding.
Okay.
Yeah. Just a minute, please. Hold on.
Somebody's at the door.
The federal program
is at the door. Yeah. I'm going to have to say, have a great week.
Thank you. Goodbye.
Well, I think that the federal.
Thank you. It's great you're on the show, Mary Ann.
Thanks.
Thanks.
Yeah,
Okay.
the senior employment program, it's still there. What has happened is they have rebid it at the federal level, and they've they're just holding things steady right now. They're not really allowing us to bring more people on until we get the results of that bid. But we're very confident that Senior Services America, who is our biggest